Hey, Dr. Ken DeLay here. So we often think about obesity as something that causes cardiovascular disease and diabetes. And while it definitely does that, there are a number of urologic conditions which are more likely in folks who are suffering with obesity. And let's go through 4 of those today. The first, in my wheelhouse, erectile dysfunction. So erectile dysfunction, difficulty getting or keeping an erection, is more likely if you're obese because obesity affects our blood vessels. You're more likely to have the metabolic syndrome and inflammation, and all of that causes ED. Not only are you more likely to have ED, you're more likely to not respond to pills like Viagra and Cialis. They can still help you, but you're more likely to be affected by that. Kidney stones. So if you have obesity and a BMI over 30, which is not hard to do, you have a 50% higher chance of having kidney stones, both calcium-based stones, which are most common, but also uric acid stones, which are more common in diabetics. 3, prostate cancer. Believe it or not, probably through effects on estrogen and hormonal changes, men who have obesity are more likely to have prostate cancer and probably are more likely to have high-grade or high-risk prostate cancer. And the last one is BPH, or enlargement of the prostate. Now, there are a couple of reasons for this. It may be that the prostate isn't necessarily any larger in a man who has obesity, but they're more likely to have inflammation in the prostate, which causes worsening urinary symptoms. So men who are obese are more likely to report having trouble with urination. So obesity is a bad thing across the board, but affects these 4 urologic conditions.